Welcome, welcome. Thank you for being here with us today. This is the Governor Council on Substance Use Disorder and the Rutgers School Social Work Center for Prevention Science. You are at an introduction to risk and protective factors within prevention. So thanks for being here with us. And the next slide. So I want to set a little context here and talk about why we come together. So this series of trainings and technical assistance sessions and peer sharing events, we're having these as a function of the New Jersey Prevention Science Training Series. So this is brought to you by your leadership team at JICSUD, and the components are virtual trainings, peer sharing calls, technical assistance series, and as well as a culturally humble leadership intensive. And today is the first of our virtual trainings. So this is a webinar, hour and a half webinar on risk and protective factors within prevention. And so having said all that, I'm going to turn to your leaders at JICSUD, Rebecca Alfaro, and she's going to say hello.
Thank you, Claire. Welcome, everyone. We're very excited to offer these training opportunities, and especially this one, our first virtual training for you all. So I want to really thank our partners over at EDC, Jess Goldberg, Carol Oliver, our presenters today, who we've worked with for many, many years and have done phenomenal work in the field. You have some really great experts for you today to hear from and to learn from and to engage with. And again, thank you to our partners at Rutgers, Claire Neary, Kristen Gilmore Powell, for being just amazing partners in this project and for helping us through getting all of these trainings in. So again, I won't take up too much of your time. I just want to thank you all for being here, and we look forward to this training. Thank you. Claire, I'll turn it back over.
Thank you. Thank you, Rebecca. All right, and so we'll go one more slide. I'm going to tell you all just a little bit about your trainers. Today's trainers, who, if you've been here with us before, you'll know are Jess Goldberg and Carol Oliver, both with the Education Development Center, are partners here at the School of Social Work. Jess is a training and technical assistance specialist, and for more than 15 years, she has specialized in building capacity to improve behavioral health at the national, state, regional, and local levels. And her areas of expertise include, but are not limited to, preventing youth substance use, promoting cross-sector collaboration, addressing health disparities, strategic planning, and logic model development. Carol Oliver is a nationally recognized leader and trainer in substance misuse prevention, and her expertise includes, but is not limited to, knowledge translation, instructional design, and strategic planning. And she specializes in developing systems to solve complex health-related problems and creating effective behavioral health workforces. And they're a wonderful resource for us here, and we're so fortunate to have them. And I think you're really going to get a lot out of today's session, and it will be enjoyable along the way. And we're going to go one more slide. And I'm going to tell you a little bit about the learning objectives for today. So at the conclusion of today's session, we anticipate that you will be able to define key characteristics of risk and protective factors. You will be able to describe the relationship between any one community's priority substance misuse problems and the risk and protective factors that influence them. And also to be able to identify steps in the process of identifying and selecting risk and protective factors that are most relevant to address in your community, right? Where prevention, and particularly where the Alliance system lives locally. So thank you very much. We want this to be as interactive a session as possible. Anytime you have a question or comment, please just let us know or put it in the chat. We'll be monitoring the chat. And that's it. We are ready to go. And I'm going to hand you over to Jess.
Thanks so much, Claire, and thank you to you, Rebecca, and Sarah, and the whole team over at JICSUD for this opportunity. I'm very, very happy to be here with you for this, our first webinar in the Prevention Science Training Series, and to be joined by my director and my mentor, Carol, who you'll be hearing from later in today's presentation. So we're going to talk a little bit about risk and protective factors. We know many of you will be familiar with risk and protective factor theory. For some of you, it may be new or a review, which is great. And we're going to just start off today by asking you to share, in your own words, a definition of risk and protective factors. So think about if you were having a conversation with a friend over lunch or having coffee with this friend, and this person had, very little understanding of prevention, and you were going to try to explain risk and protective factors to them. Just think about in that scenario, what would you say? How would you get the idea across in a way that would be really clear, really readily understood by this person, and an easy way to think about risk and protective factors in your own words. So I'll give you just a moment. You can feel free to pop your thoughts in the chat when you're ready. And so a definition that works for you and maybe would work for someone not as familiar with prevention around what risk and protective factors are. Give you a moment to riddle that out, and I'll keep my eye on the chat for whenever you're ready. Thinking about risk and protective factors. We're going to introduce an idea that I particularly like. I think I probably learned it from Carol, the idea of risk and protective factors as levers. And I won't give too much away now, but we'll talk a little bit more about what that is in a minute. So that would probably be where I would go. I'd try to use an analogy of risk and protective factors as the levers that we work through and that we use to make change in these bigger substance misuse related problems that we're trying to address. And I don't know, Carol, I can tell from your face you're thinking. I wonder, how would you answer the question?
Yeah, well, you're seeing me smile because I love the question, because that's actually a question I often get, or one that I bring up. Like when people want to know, like, so what do you do? What's prevention? My favorite things to talk about are risk and protective factors, because I think they're not necessarily known, that people don't necessarily understand how it works. So yeah, you're seeing my excitement for risk and protective, and it is challenging. How do you then explain this to somebody so they really understand it and it rings true for them?
Yeah, not an easy task. So we've
Not an
started
easy
off
task.
with a
Yeah.
challenging question, but I see a couple folks putting thoughts in the chat. And if you're typing, please do keep typing. I'd be really excited and curious to hear what's coming up for folks on the line. But Claire, thanks for starting us off. The component of the community that protects or puts young people at risk. Absolutely. I think that's an excellent way in thinking about components of the community. Sometimes we'll talk about community, right? And Brenda, you're starting to get to that when you're talking about, an environment, like thinking about your environment. So what are those conditions within an environment that might put people at risk for an adverse outcome, or might protect those people from that same outcome? And you're also mentioning trauma, which absolutely could be an example of a risk factor or an experience that someone has that puts them at greater risk to experience, a substance use or behavioral health related problem. So really nice examples. And I really like this idea of the components within your community that either protect or put people at risk. And Amber, increasing or decreasing in influence. Absolutely. We talk about risk and protective factors as those components, those conditions or characteristics that do increase or decrease risk. And those factors are what really have influence over us as individuals, in the context within which we live, and also influence over the problems we're trying to address. So that word influence, you'll probably hear Carol and I say it more than once this morning. So it's absolutely, you're really touching to the heart of what these factors can do and the relationship that they have with the substance misuse problems that we try to address. So
Jess,
really,
I was going to say, I had a friend who, when they would describe protective factors, and I still think about the analogy as a warm coat. They would say it's like a warm coat on a really, really cold day that, it's all those things of protection. And to this day, when I think of protective factors, I think of a warm coat. And given I'm in the Northeast and it's really cold, it's good timing.
Absolutely. I love that. I've never heard that, but I think that that's exactly what a protective factor does, right? It kind of buffers from the exposure to other
Exactly. It
factors
buffers to the exposure, right? Yep.
Yeah, absolutely. So I think it's brilliant. Your friend is brilliant. as are, I think, these responses in the chat. So Jessica, absolutely thinking about things like the conditions in your neighborhood. If there's a lack of economic opportunity, absolutely something that can put people at risk. If a neighborhood experiences community violence, right, that for sure could be an example of a risk factor. And sometimes the best way to try to explain something to them is give them examples of what it looks like, right? So to this question of how would you define risk and protective factors, sometimes it's just as quick to kind of give some examples of what it would look like. And your point, protective factors would be, information, knowledge, programs, absolutely access to programs and services can be incredibly protective. So these, I think, would be a great place to start as far as putting together your own definition for risk and protective factors for your friend over lunch, and certainly for us to come together and start creating a shared definition. Really appreciate you thinking that through. I know it was a tough, it was not a softball question to start us off
No,
this
you
morning, but
you definitely you started with a tough one.
we did, but I think that we met the moment. So thank you so much for sharing your responses. And I'm going to share these definitions that might be familiar for some folks, but just for the sake of that shared language for us all, we'll define the terms and introduce a little bit of the history as well. So you might be familiar, some of you might be familiar with this famous longitudinal study, the Framingham Heart Study, which is one of the most important research projects of the 20th century and continuing now. Since 1948, the Framingham Heart Study was under the direction of the National Heart, Lung, and Blood Institute, which was also in the past known as the National Heart Institute. And it's been committed to identifying the common factors or characteristics that contribute to cardiovascular disease. And it's followed cardiovascular disease development over this long period of time in 3 generations of participants. So someone called Dr. Thomas Dauber was the first director of the Framingham Heart Study. And he led that from 1949 to 1966. And during that time, they began to find links between vascular diseases, which are the leading cause of death in the US, and factors like, diet and blood pressure and exercise and smoking. And so with those associations, Dr. Dauber coined the term risk factor in 1961. And since then, that term has now been applied to many other diseases and disorders, circumstances and events. If you flash forward then to the 1980s, 2 doctors over at the University of Washington, Dr. David Hawkins and Dr. Richard Catalano, were actually the first to compile a list of risk and protective factors related to substance use and other problems occurring in adolescence. So just a little bit of history for you, and you can see here on the slide this definition of risk factor as a characteristic that exists at the biological, the psychological, family, community, or cultural level that 1 precedes and 2 is associated with a higher likelihood of problem outcomes. So this definition comes from the Institute of Medicine, which is now called the National Academy of Medicine. And I think the language really underscores the fact that risk factors exist within all of these different contexts or domains in which, we play, we live, we learn, we work, we grow. And that includes our family structures, our peer groups, our communities, the broader societies that we're a part of. And then risk factors also exist within us at the individual level, right? And that's where they're talking about biological, psychological characteristics in this definition. And you can see on the next slide, the definition for protective factors really mirrors the definition for risk factors. And it describes the relationship that leads to a lower likelihood of a problem occurring. And just a few things to note here about protective factors. So like Carol was saying, protective factors can reduce the negative impact of risk factors. They're not the opposite of risk factors. They're not the absence of risk factors, but they do buffer the effects of exposure to risk factors the way that warm coat would. And when we think about something like resilience, right, as the ability to recover from or adapt to adverse events, it's helpful to remember that ability really is actually a protective factor. And as we work to bolster protective factors in our community, that's squarely down the middle of the plate for us in prevention, because, as you know, even though prevention is often, it's thought of in relationship to a problem we're trying to prevent or eliminate. It's not just about eliminating negative behaviors, right? Prevention is also about creating and supporting conditions that can help youth and adults, develop in healthy ways and help us attain and optimize our well-being. So just a couple things to keep in mind in our conversation about protective factors. And in the context of substance misuse prevention, risk factors, increase that likelihood of a substance misuse problem occurring. Protective factors decrease that likelihood by creating conditions that are supportive of healthy development and help to buffer that risk. And just at the bottom of the slide, naming names, you'll hear a lot of analogous terms for risk and protective factors, right? You may hear people talking about intervening variables or contributing factors, root causes and local conditions, right? And so on. And you'll see that word levers there that I mentioned. And just a quick word about that, right? We know that substance misuse related issues, behavioral health related issues in general are so large. They're such large adaptive problems that we really can't reasonably expect to make change directly to them, right? We can't go from our problem to a strategy and expect to be effective because the problems are just that great, too big to do that. And so we think about risk and protective factors as acting as levers in the sense that they can be influenced, there's that word, right, to increase or decrease the likelihood of our negative outcome occurring, right? So they kind of act as, control points to whether positive behaviors or to promote positive behaviors or mitigate potential risks, depending on which factors are focused on and addressed, right? So essentially, by addressing and enhancing protective factors while we're also working to reduce risk, we can have individuals and communities really positively shift that balance toward better outcomes. And the factors themselves are those levers by which that change is made. And I know I'm stealing Carol's analogy, so I'll just
That's okay.
Carol, do you want to add anything to that? Because I want to do it justice.
No, I love the way you put that. I love the way that you talk about the levers and the change. And yes, so no, it's great.
Okay, good. All right, good. I got the stamp of approval. It's always scary when you steal someone's story and they're on the phone. They're
Please
on the
steal
line
away.
with you.
Steal
They're on the
away.
line with you. Thank you for that. Okay, so we're going to start to explore some of the defining characteristics of risk and protective factors, right? So including the importance of focusing on factors that have been identified through research, recognizing that risk and protective factors operate in and have influence across these multiple contexts, that they're both correlated and cumulative, and I'll explain more about that in just a moment as well, and that they really truly are far-reaching and have wide-ranging effects. So we're going to talk through each one of those characteristics, starting with being evidence or research-based. So if I were to say or tell you that a risk factor for lung cancer was eating candy, you might not believe me, right? But if I told you a risk factor for lung cancer was smoking, you might be more inclined to believe that statement because we've studied this issue over time, and many of us are aware that there's research to back that claim up, right? There's evidence that it's true. So some risk and protective factors are not evidence-based, right? So that is that we don't have research to verify their role in influencing the problems that we're trying to address, right? And in our field, sometimes we come across people who will say that even if the research doesn't show a particular factor to be a risk, common sense indicates that it's a risk, right? And since prevention is such a social issue, right, socially related, and people have opinions about it based in their own experiences, and that makes perfect sense. But we really need to lean into what research shows is effective and works in prevention, both in terms of the risk factors that we select and the strategies that we choose to prevent them, right? And sometimes those aren't always in perfect alignment with what people think is common sense. So it's really important. I think the point here is to stick with what is research-based while we're still, open to and respectful of other people's views, but when we're developing and selecting, particularly as we get to the point of interventions, right, just as important to be research-based as we talk about risk and protective factors. But as we go to implementation of our strategies, we want to be sure we're developing and selecting these interventions and we're sticking with what is based in research, or also referred to as evidence-based.
And Jess, I wanted to mention something in reference to that is,
Yeah,
I think
please.
the other thing, I've been in the field for a long time. So I have been in the field and I worked with communities when they were picking risk factors that weren't based on evidence and then implementing great stuff for that risk factor and putting in so much time and energy, but it wasn't moving the problem. And so I think the other thing about the evidence and going for evidence is you increase your likelihood for success. And the other, I think, beauty and thing about prevention is it involves the whole community. And to get the community involved, to get people sitting around the table, to get their buy-in, you want them to experience success. And so I think having witnessed many communities go through, not having an evidence-based risk factors and then finding change wasn't occurring. I think that's another reason for me personally is to try to have people see that. And it's hard because there is that common sense says that self-esteem should predict whether, that should be a risk factor. And sometimes people are like, but who are you to tell me that it's not, right? And so we run up against this common sense. And I think what keeps me at it is that, but I don't want to see you implement things that will just not result in change because it's disappointing for them, for all the work that they put in. So just wanted to make that point.
Yeah, it's a great point. Thank you for that, Carol. And we'll talk later too about this idea that yes, looking to the research is critically important, and looking to your community and understanding what is present, what factors are present in your community that are driving to or contributing to the issues or mitigating the issues that we're seeing. Like that, it's a sort of two-pronged process to make sure we're working from an evidence-based and informed place, and also to understand what's really like happening in our community, to truly have that strong understanding and be able to select risk and protective factors to focus on that sort of check both of those boxes, right? You're here, they're in our community, they're making impact in our community. And we know from the research that if we spend our time, our energy, our partnerships, our resources on addressing them, that we will move that needle and we will see those outcomes that we're trying to reach. So I think it was a really, really important point. Thank you for adding it. And we'll have a little time to talk about that a little later in today's session as well. So just a few examples here of evidence-based risk and protective factors on this slide. Every problematic behavior we try to address is going to have a set of related risk and protective factors. And so you see this is for underage drinking here. And I'll just talk through, what these mean for folks that aren't as familiar with them. So starting with risk factors, low perception of harm is when we talk about the level of awareness of harm or of the risks involved in alcohol use. And so sometimes you'll hear that talk about called perception of risk of alcohol use. And that's something, that we see in the individual, so their particular level of perception of that risk of that harm. Social norms that accept underage drinking so social norms for folks not as familiar are these sort of spoken or unspoken rules that govern people's behaviors. And so in this case, those rules would be tolerating of underage drinking. Easy retail access is when, underage youth would be able to easily obtain alcohol at a retail store, either by purchasing themselves or by asking others to buy it for them. Low enforcement of alcohol-related laws. So, in other words, if a liquor store were to sell alcohol to minors, or if an adult were to give alcohol to minors, the likelihood that they would experience any legal repercussions would be minimal here if there was low enforcement. Easy social access would be would mean it was relatively easy for youth to obtain alcohol that they drink from someone who gives it to them, or from home, or from family members or peers. And then low or sufficient parental monitoring parental monitoring involves things like, rules that parents set for their children, the communication that they have about the risks and consequences of alcohol use, and then appropriate behavioral modeling. And then on the other side of the screen for the protective factors, you'll see low sensation seeking personality. So this is an individual personality characteristic, where folks aren't looking to participate in risky behaviors for the experience of the sensation of it. Having fewer positive expectations of alcohol, another individual level factor for someone who positive outcomes related to using alcohol. Pro-social activities. So, if an individual or group is engaged in, social activities that don't include the use of alcohol, volunteering is cited in a particular study that we referenced as one of those pro-social activities. Those individuals are going to be less likely to engage in the risky behavior of using alcohol. Having fewer friends that use substances, we know that being around peers who use alcohol and drugs, would make or who do not, right? If you have fewer friends who use alcohol or other drugs, it makes someone less likely to also use those substances themselves. Parent disapproval of substance misuse and other related behaviors. So perceived messages of parental disapproval around using alcohol and consistent parental messaging promoting non-use can really help promote that non-use behavior. And then this idea of positive opportunities to belong. So experiencing what it means to really be a valued part of a community, having that feeling of being included by a group having really meaningful options to have that experience can be very protective, we know. And so just to say out loud, there are connections between these factors, right? Between many factors. For example, if you were to have increased parental monitoring, right, that should theoretically reduce social access to alcohol from the home, right? So, if you move the needle on one of these factors, you would see potentially impact in others. And each of these factors exists within one or more of domains of the socioecologic model, which you probably are familiar with, but I'm going to introduce here on, see it pictured here. All people, have those biological, psychological characteristics that, make them vulnerable to or resilient in the face of potential behavioral health issues, right? And those are the behavioral health, or I'm sorry, those are the risk and protective factors that you would find here in the middle of this graphic at the individual level, right? Because people have relationships within their communities and larger society. Each person's biological and psychological characteristics exist in these multiple contexts that you see pictured here, right? Within the relationships that they're a part of, their communities, and the larger society that they exist within. So a variety of risk and protective factors operate within each of these contexts. These factors also influence each other, right? So we know in prevention that focusing on just one of these contexts, right, when we're addressing a person's risk and protective factors is unlikely to have the impact we're looking for or be successful, right? Because we know people don't exist in isolation. So some examples here of risk and protective factors across some of these relationship and community level domains. So in relationships, we're talking about factors within someone's social circles, so the knowledge, attitudes, the beliefs, the skills, the behaviors of family members, friends, coworkers, etc. And so risk factors, these are just examples, would include, parents who use drugs or alcohol or who suffer from mental illness, experiencing, child abuse or maltreatment or inadequate supervision, right? And in this context, things like parental involvement and family bonding would be examples of protective factors. In communities, risk factors exist within and across the settings where we spend time, like our neighborhoods, schools, businesses, right? So an example of a risk factor might be neighborhood violence, someone already mentioned in the chat. And here protective factors might be, the availability of faith-based resources, faith-based organizations, and after-school activities. And here in society at the structural level, we're talking about things like governing bodies, legislatures, systems like health and education systems, right? Risk factors can include things like norms and laws that are favorable towards substance use, as well as racism and the lack of economic opportunity. And protective factors in this context would include things like laws against hate crimes or policies that do limit the availability of the substances we're trying to address. And so factors do not operate independent of one another, like we said. There are close connections, right, and clear relationships among them. And so these terms, correlated and cumulative. So risk factors tend to be positively correlated with one another and negatively correlated with protective factors. And so what that means, in other words, is people with some risk factors have a greater chance of experiencing even more risk factors, and they're less likely to have protective factors in their lives. Risk and protective factors also tend to have a cumulative effect on development or reduced development of behavioral health issues. So the more risk factors a person experiences, the more likely they are to experience a problem. So young people with multiple risk factors have a greater likelihood of developing a condition that impacts their physical or mental health, right? Young people with multiple protective factors are at a reduced risk. So an example here could be, relating to cardiovascular disease, right? Smoking plus a sedentary lifestyle plus diet leads to more likely to have heart disease. And the same principle is true when we're talking about substance misuse and behavioral health. And so these correlations really underscore importance of things like early intervention and interventions that focus on multiple and not just single factors. And the last characteristic we'll explore about risk and protective factors are that they have wide-ranging effects. They're really incredibly important, and they influence each other in many different ways, right? Including across levels and domains. So, something I experience in my relationships or in my community, right? Community violence, for example, can influence me at the individual level. Within domains, factors influence each other too. If I have really supportive parents as a young person in my relationship domain, that can reduce the influence of having peers that misuse substances, right? Which is also in my relationship domain. Factors are influential across outcomes. And even though preventative interventions are often designed to produce a single outcome, both risk and protective factors can be associated with multiple outcomes. And Carol will say a little bit more in a few slides on that. But for example, negative life events are associated with substance use, as well as, mental health related concerns like anxiety, depression, other behavioral health issues, right? So prevention efforts that are focused on a set of risk and protective factors have the potential to produce positive effects in multiple areas. Again, we're going to talk a little bit about this idea of shared risk and protective factors in just a little bit today. And then risk and protective factors can also have influence throughout a person's entire lifespan. For example, risk factor of family dysfunction can contribute to the development of mental and or substance use disorders later in life. Risk and protective factors within one particular context, such as the family, can also influence or be influenced by factors in another context. Effective parenting has been shown to mediate the effects of multiple risk factors as well. So, and something to consider here, I think I can show you on my next slide. It may not be my next slide, it might be one more slide, but I'll say a little bit more about how risk and protective factors change across the lifespan in just a moment. So here you'll see a few examples of factors across context or domains in that sociological model at the individual level, and these are protective factors. It's very protective to, again, have that low sensation-seeking personality, have fewer positive expectations of alcohol. At the relationship level, that peer group that doesn't use substances is really protective, as is those clear expectations and guidelines from parents. There's they can be very protective, as can the opportunities for the pro-social involvement and that recognition for positive behavior within our communities. And then also having legislation and policy in place that supports things like the expansion of behavioral health services and promotes racial and health equity at the community and societal levels. So this is just a visual example of what these factors looks like across contexts. And here's an example of how risk and protective factors change over time in the lifespan, right? So you'll see here on the left-hand axis, early childhood, middle childhood, and adolescence. And so factors that are influential in early childhood, right? And you can see on the slide, these are all protective factors here as well. They're not necessarily going to be influential in middle childhood or adolescence or later in life, right? So if you think about the type of reliable support and responsiveness a child would need from their family in early childhood, right? A hug when they fall down and get a boo-boo, or someone to come in the middle of the night and hold them every time they feel afraid, right? Those are not distinct conceptually from the type of physical and psychological safety and supportive relationships with family members that they'll need as adolescents, but you can see how they would play out would be really different and takes very different shapes based on where they are in the developmental lifespan, right? So this again is just a visual example of how risk and protections change as we move forward in our developmental trajectory. And so this is a pretty simple slide. It's very simple. It's succinctly describe what we're trying to do in prevention, right? Increase protection and reduce risk, right? So traditionally, public health, prevention, community health work, we focused on reducing risk. And that's a really easy concept to grasp, because it relates so closely to our medical system, right? The community has a problem and it needs to be healed. And like a doctor would do with a patient, if they're taking the pulse or their blood pressure, to diagnose, the high risk, that contributes to later problems like heart disease. Prevention folks would diagnose a community and identify proven risk factors that contribute to, the complex issues we're trying to address. And then prevention would find the appropriate medicine or strategies, that are proven by research to reduce that risk, identified for those problems. We know now, protection for youth and families and individuals and whole communities exist, and they're really worth growing, even when it's difficult, right? Sometimes these can be difficult to see in our communities, but really important to invest in growing our protective factors as well. And I think the field of prevention is focusing more and more research on the strengths or assets or protective factors, to build those protections. Many community partners really resonate and feel more hopeful and motivated to engage with prevention interventions and strategies that work to grow the good, right? Grow the strengths of the community. For example, like through a positive community norms approach. So there's a lot of exciting work and research being done out there demonstrating these successes in reducing substance misuse and other behavioral health issues. So just naming that it's a two-pronged approach, right? Where we both work to grow our protective factors and reduce those risk factors. So that's just a little bit about risk and protective factors and some of the defining features they share. So I think now I'm going to turn the time over to you, Carol, to explore what it looks like to work with risk and protective factors in our prevention practice. So whenever you are ready.
All right. Next, I have to say, Jess, I learned things in your presentation that I hadn't heard. So I thank you very much. That was incredibly informative.
That's high praise.
We're going to move from sort of what they are, which is fascinating and interesting. It can also feel a little overwhelming, right? All these multiple contexts and multiple across the lifespan. So what we want to do is talk about the connection between risk and protective factors and the priority problem and how to help you operationalize them, right? How do you put these into practice? And throughout this, while we're going through this, one of the things you'll observe is, I think when you're working with other people, because prevention is all about getting community buy-in and having communities, your coalition, your advisory committees, whomever you have making decisions, making it as concrete as possible, right? Taking the theory, taking the ideas, and then turning them into doable things that you can use. And so as we go through, we're gonna actually use some actual tools and resources that actually get used in the field. And we actually use a lot to teach for that reason of sort of helping people then use it into their work. So the first thing we're going to talk about is the connection between risk and protective factors and the priority problem, because by themselves, they're fascinating. But to really make change, we've got to connect them to a particular problem. And as Jess said, each problem has its own set of risk and protective factors. They may be similar, right? You may find access is a risk factor for underage marijuana use, and it also is a risk factor for underage drinking. But the access issues themselves, what happens, the conditions in them may be slightly different. So next slide. I don't think I can, yeah, next slide. So we're going to start with you, which is, have you identified any risk and protective factors that are influencing substance misuse related in your community? So have you worked with them? And if you have, what have you worked with and what have you identified? What's kind of going on in your community? So we'll give you a moment to think about that. And as you're doing that, I will tell you, since Jess went through and showed you the risk and protective factors, I have actually worked with communities in trying to have the community coalition understand risk and protective factors, and literally created a card game where on one side of the card you had the risk factor, on the other side you kind of had, this is what the research says, and you kind of give them out and you do sort of interactive activities. So the coalition actually gets to interact and play with them. So they become familiar and comfortable with them. So there's sort of ways of sort of making the risk and protective factors fun. So any examples that anybody has that they've used with risk? And it's okay. Yep. Mental illness seems to be a leading influence. Okay. And there is a big, there is a connection between mental illness and substance misuse. And actually, there are particular time periods within where that connection is stronger, and using substance misuse actually is a precursor for mental, different kinds of mental problems. Yep. Any others? Okay, well, we'll give some examples, and if you think of some as we're going, we'll have you put them in the chat. Okay, next slide. Can I move this myself, Jess?
I can set it up so you can, I think. Let me try.
Oh, that's okay. I can just keep on asking you to move the slide.
Okay.
Oh,
Whatever
actually, we
works.
have some others. So, early first use, availability, favorable social norms. Yes, I have to say, the early first use is one of the most interesting things I tell parents when they're saying, oh my God, what am I going to do? My child's going into adolescence. And I often say, if you can keep your child from using before the age of 15, they have a real reduction in the likelihood. And they're like, wow, that's something I can really focus on. So early first use, when they start. The other one is many stars. I think that Robert Downey Jr. is a good example, who had a very well-known substance use disorder. He started using in his early middle school years with his father. And those are two risk factors, right? Parental use, high parental use, and parental norms plus early first use. So let's see, undiagnosed mental health problems, peer substance use. Yes, the fact that your peers may be using or they have favorable drug availability, poverty, peer rejection, and child abuse or neglect. So some of the pieces that we are highlighting as potential risk factors are very, very large connected problems. So the mental illness, the undiagnosed mental health problems, and poverty, those may be connected. But the other thing is, we also, and this is when we go through, you'll see, is they're very large topics on themselves to tackle. So sometimes when we're talking about risk and protective factors, we want risk and protective factors that are connected to the problem and related behaviors, but are also changeable, right? That are also feasible, that within a grant for 5 years, you could actually do a strategy that would impact. And although it's true that mental illness is a piece, and you might be able to do things like early diagnosis and some of those pieces, right? You just want to make sure that the risk factors, you have feasibility in being able to sort of move that lever and change them. So this particular slide I really like, and this goes back to the concreteness, right? This is our roadmap. We have a problem, and we've gone through and figured out what that problem is. And in this case, it's underage drinking. There's a universe of risk and protective factors that we want to think about that may be driving the problem. We want to figure out which one of those do we want to be able to focus on. The backdrop of all of this is your community, because prevention is local. So the resources, the readiness, that's all based on your particular community, and then the intervention. So what this does is it really allows us to sort of line up, the problem and the risk and protective factor, and figure out, of the different risk and protective factors, which combination are present in my community, are changeable, and which do I want to do to move the lever so I can change the problems and behaviors. I think the other thing that this particular roadmap does, which I really like, is it shows it that it's population level. So one of the other areas I find over the years when I've worked with people, even in my personal life, sometimes it's a big, well, what do you mean you're not changing an individual? You're changing a whole population. You're changing all like 9th graders. And I think what this does is it shows these are population level problems. If we said problems and we said cancer in my community, or we said high blood pressure, and then we said, we know the risk factors and we're going to work on those, people would understand, because those are public problems and they are preventable. And the same thing is true with substance misuse. And so I think that this also helps to illustrate that this is a population level problem. And that's why we need several different risk factors, and they may be on, as Jess said, those different levels: individual and family and community and society. And one of the things I learned early on as a preventionist that always stuck with me is, in order to make change, you have to have multiple strategies across multiple populations, across multiple levels, because these are complex problems. And I think oftentimes we get into this one strategy is going to fix this one problem, or this agency has a grant and therefore they're going to fix this problem. But the truth is, one agency, one school, one police force alone can't do it. That's why we have community coalitions. And that's why we, in substance misuse, we are going to select risk and protective factors that really probably are going to cross the different community. And it's not just going to happen in one particular organization. So anything you want to add to that, Jess?
Oh, I thought that's brilliant. No, just really nice kind of thinking about it in practice. So thank you.
Yeah, and what I like about this is when I work with a coalition, I often will write this on a piece of paper and say, hey, tell me the problem you're doing. And then, oh, have you selected risk and protective factors? And then, oh, you haven't. And so it allows to give this shorthand of kind of where you are and how things line up together. All right, so I think you gave it so I can, all right, oops. Sorry. Wait, is this the next slide? This is the next slide, correct?
I think that's it. Yep.
Yeah. Okay. So this is just another example, right? This is the 3-box logic model. And what you'll see, if you notice these risk factors, these are risk factors that Jess mentioned earlier. And so part of what I'm doing is I'm figuring out what these risk factors are. And then what we're going to talk about is then how do I kind of narrow the total amount of risk factors? Because there's only so much you can do. And so what you would do with this 3-box logic model is sort of fill in each one of these. And then what you find is you'll then have strategies or interventions that are linked to these particular risk and protective factors that you select. All right. So again, this just is sort of giving an example of the resource of what the 3-box logic model can do. Just also mention this, which is really interesting, is risk factors may cross different kinds of issues. So substance misuse, delinquency, teen pregnancy, school dropout, violence, anxiety and disorder. And there are things in the literature that actually allow you, like this chart, to see which are the risk factors that may be impacting more than one problem. The other thing you find, which is not listed here, is you may find these similar risk factors across public health problems, like problem gambling and substance misuse have a lot of risk factors that are in common. As does some risk factors are in common for suicide prevention. And so what that means is that I either, for collaboration's sake, like we have a shared risk factor, do you want to work with us? Or if we pick this risk factor or protective factor, not only are we affecting substance misuse, we're affecting these other issues. And so it may be a consideration. So, oops. Let me just plug in my computer for a second. Sorry, I thought it was plugged in. That happens sometimes. Okay, now I won't lose power. So what we call these are, these are called shared risk and protective factors. And so what you're looking at is where is the intersection of where this is in reference to. So perception of harm in reference to problem gambling and substance misuse, this idea that if I perceive it harm is a shared risk factor, one on problem gambling, one in reference to substance misuse. The idea of access is actually a shared risk and protective factor. So looking at this, and there are charts and things like just showed you that actually line up the risk and protective factors, so you can see which one of those are shared risk and protective factors. And again, it's very helpful for building partnerships with other people of sometimes, and this will come up in coalitions, well, you know, why don't we get a bigger bang? Why are we just going for this? There are lots of problems that we have. And so shared risk and protective factors are a way of sort of addressing multiple underlying problems. What's important with shared risk and protective factors is that you may have a shared risk and protective factor and it's shared, but it may not be the risk factor that's really driving the problem in your community. So it's important to understand which risk and protective factors are shared. But if you make the decision only on the fact that the risk factor is shared, you may not actually get the lever that is really driving the problem in your community. And so that's a consideration too. All right. Oops, sorry. So this is a big, so how do we select them? How do I identify and select the risk and protective factors to address? And there's a really, again, we're going to be really concrete in this. There are a couple of different, so one, we look at the SPIF model, oops, okay, it's grounded in the SPIF model, sorry about that. And it's part of the planning process. And so within the strategic prevention framework, this step is not that it matters, but this step is my favorite. It's where everything comes together. All the information people have been collecting comes together, and then people begin to get to be able to make some decisions, which is a very exciting, and it often should involve parts of the community. So when we're selecting the risk and protective factors, there's really a 4-step process. And we're first going to identify them, we're going to narrow them, we're going to finalize them, and then we're going to match them to the intervention. Now, has anybody, and you can just say yes or raise your hand, has anybody actually prioritized risk and protective factors? Has anybody kind of gone through this process who's on the phone? And I'm going to need help seeing raise of hands if they can be done. Okay.
I'm looking, Carol. I don't see anyone raising hands
Okay,
yet.
so we're going to take our time to do this. And one of the things is that as time has gone on and people have prioritized, some states and some who actually give out grants have created some really nice tools to help you again make it really concrete. And we're going to share some of those with you. All right, so we're going to go to the first one. Okay, so the first place you're going to look to is the information collected, right? And so in surveys, often in youth risk behavior surveys, you will find questions that are related to risk factors. There may be one about how are you accessing alcohol. There may be some on what's your perception of harm of this particular risk or protective factors. So there may be questions that are in the survey that actually get to the risk factor. And you can start there. You can also observations. So when you're in a coalition community task force and you're having a conversation, what is coming up? You may have done key partner interviews. So what do the police think in reference to some of the enforcement related kinds of risk factors like access and enforcement of existing laws? What does the city council think? And what's going on in the local faith community? What's going on in the school? I find people like to have conversations about, this is my perception of what's going on. This is my perception of the problem and what's driving the problem. And from that, you're going to get some risk factors and protective factors that you're going to say, okay, here's what seems to be present within our community. Here's sort of the universe. You then want to go back to where Jess talked about, but we want to make sure there is an evidence-based connection, right? We want to take it from perception to evidence, because what we don't want to have is pick a risk factor that isn't really the right lever. People implement the program beautifully and change is not happening. And so we also want to go back. And so one thing you can do is you can go to academic research and you can ask the question, what are the risk factors and protective factors that are driving underage marijuana use or underage drinking? And a lot of articles will come up that you can look at. You can look at evidence-based registry. So when somebody designs an evidence-based practice, normally in the description, they have selected risk and protective factors in order to address what they're going to address. And again, just like you looked at your local information, you can look at national and state surveys that have questions that are risk and protective related on the question. Now, that may seem like a lot. So I think starting with the surveys, right? Starting with the data you have, and then going and looking at the literature and seeing what other resources your state might have, because sometimes people here's a list of risk and protective factors that we know are evidence-based. Jess had one on the screen, and it may be as easy as, okay, let's check this against this common list. You may have some that are not on that list, and then you may want to go in and say, okay, let's do a little bit of digging and seeing if these are those or not, right? And so it doesn't have to be hugely complex. Sometimes just when we do these presentations, it feels like it can be absolutely overwhelming. And so I just want to say, like, it does not have to be. And I always say, whenever you're going through a process like this, just start where you are. Start with the information you have, start with what you've gathered. And then if you need to go back and you're like, we don't have enough information on this, you can do a focus group. You can do a couple of key informant interviews and to kind of get the more information. So you're kind of first figuring out what are the evidence-based approach, risk and protective factors that we have. And as Jess said, it's local in our particular community. And it's amazing how I live in Massachusetts. We've got 365 towns, a lot of towns. It's amazing how the risk factors are different from the town over from me, and it's 5 minutes away, and the town across the bridge from me, and it's 5 minutes away. And that's different, whether the parental monitoring is different, or access issues are different, or, sometimes they're similar, but sometimes it's very unique to each community. And I think that's one of the things that's really fun and fascinating about this is you and whomever you're working with are detectives. You're trying to figure out, you're trying to figure out what is it that's driving this in our particular community, which is fascinating. You're like social science researchers trying to figure out and get to sort of what is it. And I find that when you engage people with that kind of information, people can find it really, really interesting and fun. All right. So now that you have this evidence-based risk and protective factors, you then need to narrow it, right? Because you only got so much time and so many resources, and you can't do 20, you can't do 10, right? Maybe you can do 3 or 4, maybe you can do 1, you can do 2, whatever you think you can do. But we need a way of narrowing it. So some people, a way of narrowing it might be, I would like shared risk and protective fact. I would like something that's shared. Somebody else might say, I'd really like those that are in the environmental, in the severe of those that are impacting the environment. One that is very common is on the screen, which is importance and changeability. And I like these because I think they're really simple and easy to understand. Importance is how much is the risk and protective factor influencing the problem. So when I'm looking at these, am I hearing in the surveys, focus groups, when I'm talking to people, that access is the issue? Or am I hearing, oh my goodness, in our town, youth do not perceive underage marijuana use as an issue? It seems like that is they're just not perceiving it. So what are those risk and protective factors that really feel like those are the ones that are driving the problem? And you're hearing a lot about them. You're seeing it in survey data. There may be 3 of them. There may be 4 of them, right? So one is importance. The other piece, though, is we're not doing it in a vacuum. We're doing it in a community. So then the other question is, what are my resources and readiness to work on this particular risk factor? So let's say it's access, and it's the fact that we are not having enough underage drinking laws being enforced. But the superintendent of the police has gone on record going, underage drinking is not our issue. We have a huge push, and this is the area. And outreach has happened with the local police, and they are just not on the same page about underage drinking. They lack changeability, right? They're not a key partner. So when you're thinking about changeability, it's, do I have a key partner? Do people perceive this as something that we think that should change? Is it something that is feasible for us to change? And so that's changeability. And so what you want to do is you want to look at importance, but you also want to look at changeability. We also do this in our personal life, right? Like going on a vacation. Okay, it's really important to me to go to the beach, but am I going to go to Fiji in the summer, or am I going to go to, the Jersey Shore? And part of it is resources, the amount of time I have, right? It's who's coming with me. There are all of these resources and readiness questions. I'm just not ready to pack a suitcase and go all the way to Fiji, right? So changeability also happens in our personal choices as well. All right, so we're going to go to the next one. Oh, yes. So this is one of my all-time favorites. This actually first appeared, and I want to say in like 2006, 2007, by the state of Maine, when states were working with communities doing the strategic prevention framework for the first time. The state of Maine wanted to have a resource to help their grantees look at changeability and importance. And what I love about it is, one, you can sit and you can do it yourself. You could put this on a flip chart paper. You could have everybody have stickies and the information about where the risk factors and protective factors were on change and importance, changeability and importance, and you could literally put them on a flip chart paper. So the way this works is important is on this axis, right? High, low, and changeability is on top, high, low. So as oh yeah. So let's see if it's going to work. Oh yeah, okay. Oops. Oh, we'll just fill them all in. Okay. So if I was doing low, low, right, it's low importance and low in changeability, it would be a low priority. If it was high importance and high changeability, it's driving the problem, and you know what, we can really tackle this well, then I would want high, high. And when I'm trying to select a risk or protective factor, I want to go for high, high. But here's the thing, we're going to be working on this problem for a while. It may be that I have high importance, but low changeability, and I can start working on building the resources. I can build a relationship with the police. I can get inroads with the local media. We can teach ourselves what the heck is social media and how do we do it, so that, you know, that might be something that we want to tackle. We may believe that community norms is a real big issue, but our community has such low readiness that this idea of tackling alcohol being served at large community events is not going to go over really well now. But that's a potential goal down the future. So why don't we start by sort of building readiness in the community and educating on them on why it's important. So you may go for high, high, but when it comes to the low changeability, high importance, this is where, when you're talking about building a capacity plan, how am I going to increase my resources and readiness? This is sort of the areas that you're going to do it. There's also, you know, high changeability, low importance, right? And so these are things that if you needed really quick wins, if you were in a place where your community and everybody had a lot of energy about this, and it wasn't going to have a huge return, but it wasn't going to hurt, you may decide to do that, not because you know you're going to impact the problem, but because you know you're going to mobilize the community and you're going to get buy-in and you're going to build that piece of that resource. And so what I love about this model, and I love giving the state of Maine credit for it, is it allows you to very concretely have conversations about this and make plans. And it's been used all over the place. We use it in training. It was built into the substance abuse prevention skills training. But it's really useful and helpful. All right. Okay, oops, nope, I don't want that to do that yet. Okay, so this is a little bit of review. So here's our 3-box logic model. We picked underage drinking, and through the process of looking at our local circumstances, what people think, you know, the opinions, local data, we've come up, and then we've double checked that they're all evidence. We came up with this list: social access, parental monitoring, youth perception of harm, protective school engagement. But rather than going with all 4 of them, we then go through the process where we look at changeability and importance, and we then realize the 2 that have importance are the parental monitoring and the protective school engagement. And so those are the ones right now that we're going to focus in on, and we're going to create and select strategies for. So risk parental monitoring, parental education about safe storage, protective school environment, opportunities for pro-social involvement. The other thing is this example just has 1 strategy each. You may have multiple strategies for this, right? And you may have multiple strategies for this. It doesn't necessarily have to be a 1-for-1, but what you see here is through that process of narrowing, we come up with something that we know is a lever that's doable for us, that's achievable, and that we hope, based on what we understand, will actually move this lever of underage drinking. All right, so hopefully this makes it a little bit more concrete. Jess, do you want to add anything?
You know, I think you covered everything really beautifully. And the only thing I would add as you were speaking is that, you know, I know folks on this line have done the work of collecting information about risk and protective factors in the past, Carol, and that in the communities I work with, there's always this sense that we wish we had more information, and we wish, like, we just don't know everything we wish we knew in order to plan. And I just wanted to underscore, and what you had said is, you know, we do this work of collecting the information we have. We look at the research, we look to our community, and we understand what's going on kind of in real time in terms of what is present in our community, risk and protective factors. And eventually we have to draw a line in the sand and say, this is the information we have now. We're going to do a good faith effort to plan with it and go from here. And like you said, if we decide through our planning process that there's more information we wish we did have, we have these opportunities to continue collecting, having our focus groups, having interviews with our key partners to really better understand the problems that we're working with or that we're trying to address and the factors that are influencing them. But there's sort of this, I think it's a difficult reality in our field that eventually we do have to kind of work with what we have to move forward, or else we'll be in this sort of perpetual perennial like assessment phase, right? So there is this sort of recognition.
I think it's great you said, I mean, many people have heard the saying, don't let the perfect be the enemy of the good. Because the other thing that influences this is how experienced your community is at doing this process, right? It's the analogy you always make. It's the first pancake, right? So the first couple of pancakes may not come out so great, but then the next couple come out really great. And I do think you need to start where you are. And I think if you have a community that's sort of lower resources and readiness, they're just starting out, or they're less familiar with all of this, you need to make it feasible. The data collection, what can't go on forever, right? You need to make it so that people understandable and it's doable for them in the moment with what they understand to the best of their ability. The next time you go through it, the next time they go through it, they're going to get more sophisticated, understand more, and get better. And that's when we talk about sustainability, it's not about sustaining programs, it's about sustaining the process. And so as I go through, I'm going to make better and better pancakes, hopefully. And I think it's about having the courage to go through it once. Like we're just gonna try this. And I know for me, I have said to people I report to, I am willing to try anything if you allow me to fail. Right? You allow that it's okay if the pancake isn't perfect the first time. It's the fact that you're trying. And if you've never done this before, and the people you haven't done it before with, I think that you have to give yourself a lot of grace in reference to it. And there's a lot of resources, right? There's a lot of resources that are being provided through this program right now. There are office hours and there are other things that you can access in order to help you when you get stuck. So Claire, it's hard to figure out when to move forward because you don't know what you don't know. And with the Alliance, they are truly hyper-local, so getting data can be very challenging. So it's hard to accept failing, though, as just as part of learning to better process. Well, yeah, and when I say fail, it's more, you don't have to do it perfectly. And if you have limited survey data and you need to go with focus groups, and you decide to have a parent focus group and you decide to have a youth focus group and you decide to do some key informant interviews and you create some questions and that's what you have to begin with, okay. That's what you have. You can't create data you don't have, right? You have to work with what you have to the best of your ability. But what you are doing is you are making data-driven decision-making. You are intentionally collecting information about the risk and protective factors, and then you're making decisions based on that information that you have. Then in between, you can always work to say, okay, if we were going to have better data in 4 years, how could we build that? What does that look like? And where might we get it? So you're always trying to go progress towards the future. But at the same time, the fact that you are using information to make decisions that you've collected, that's really what a data-driven decision process is. Jess, anything else on that? Did I make you speechless?
No, I'm speechless in a good way, in a very positive way. But no, I think it's a wonderful reminder that it can be intimidating, but it doesn't have to be this tremendous undertaking. We work with what we have. Like we said, we increase our sophistication the more we do it. And even really like communities who've done, this work of strategic planning over time and become very sophisticated, we still get to the end of a community-driven process, and I'll have the prevention coordinator pull me aside and say, well, I know though that one of the factors that we didn't prioritize is actually really important and really
Yeah.
changeable. And I'll say, totally. Like you have a lot of knowledge and expertise in this work, and your community. Doesn't mean we can't consider and focus on it. It means we need more information, right? And so
Yeah. Yeah. We need,
how do we get that information? Because your experience is valid and it's an important source of data. And what we want is actual data, hard data or qualitative data, to back up things that we may know to be true. And then, we're just trying our best to stay in alignment with the data informed process, right? But like you say, if I talk about First Pancakes, Carol talks about building the car while we drive down the road, right? And so sometimes we do the best we can with what we have, we make our plan, and then we know where we can enhance the process
where
next
we
time.
can
So I
enhance the
think,
process.
yeah, for me, just your takeaway is that it is challenging, it's involved, but it doesn't have to be intimidating because we do the best we have with what we have.
We do right. It's feasible, right? Right. Right. That's what I want the takeaway to be, that this is feasible for people to do. The other thing I would say that's helpful, and you can create them yourselves, is when you're collecting the information. So let's say you have a focus group, you can create a chart that says, here are my 4 risk and protective factors, or 5. Here's importance and here's changeability. And then you go through your focus group and, oh, people said this about this risk factor, that must be part of importance. Or, oh, people said this, that's kind of a resource, I'm going to put that there. And so I think what you can do is, as you go and you collect this information, having a way of just organizing it. And, you can go to your survey and go, oh, you know what? Access, people really didn't feel like they had access to alcohol. Like, that doesn't seem to be very, I'm going to put that in importance because it seems to be lower. And then you just add that information in there for that particular risk factor. So that when you go to take a look at it, it's all summarized and it's organized, and you're not just dealing with, like, I think this is what's confusing in the process too. I have this focus group and I've got this and I've got this key informant interview and this. So what do I do? Literally, you pull out the pieces of information and you add them to your chart, and you kind of organize the information so people can see both the kind of survey data and the focus group, and they'll look at it and pretty quickly go, well, that's high importance, or that's low changeability, right? Because they can see it. It's right in front of them. And it also, I think, helps as the person organizing the process to remember how I'm using the data and the purpose of it, and not get lost in the collecting of it.
I think that's it for now. We're on time, which is really lovely. And thank you all for being here. And I think we can close it up.
Great. Thank you all so much.